In the United States, proton beam was really very much a research tool from about 20 or 30 years ago. At my institution, the Massachusetts General Hospital, we treated a limited number of patients, mainly children with cancer or people with these skull-based tumors. And we developed an evidence base for those specific cancers, but not for the common cancers, not for lung cancer or breast cancer or prostate cancer. Then, about 20 years ago, something happened. PSA screening was introduced in the United States, and suddenly we had an enormous number of cases of men with prostate cancer. And because their cancer was diagnosed as a result of a screening program, these were often middle-class men, men with means, men who read. And the PSA screening revolution combined with the dawn of the internet. So these men found one another, they compared treatment modalities, and many of them decided that based upon what they read about the physical characteristics of proton beam, they would like to be treated with proton beam. Now remember, at that time, the only evidence for proton beam was for the treatment of childhood cancers, not for elderly men with prostate cancer. But all of a sudden, a business model was created. There weren't enough pediatric cancers in the United States to finance these huge $200 million proton centers, but there were an enormous number of men with prostate cancer. In fact, 250,000 men are diagnosed every year. And so the vendors were ready with the equipment, PSA delivered the patients, the internet brought the two together, and with some creative financing, before you knew it, proton centers were popping up left and right. And from having just 2 proton centers in 2004, we now have 26, and at least another 10 are in the planning stages or development stages right now. And most of these were built around a prostate cancer business model. Now, it all sounds great. The problem with that was that proton treatment is phenomenally expensive. The capital costs are very expensive, and if you're going to recoup the capital costs, you have to charge a lot. And the payers, meaning Medicare, meaning the private insurers in the United States, have started to push back. They've started saying, no, we're not paying for prostate cancer treatment. And in fact, there have been many studies showing that many of these men with prostate cancer don't need any treatment at all. And that many of those who do need treatment could perfectly well be treated by other modalities, new surgery or other kinds of radiation. So the bottom has fallen out of the prostate cancer market, and we have a kind of bubble in the United States where an enormous number of proton centers have been built, not for the treatment of pediatric cancer, unfortunately, primarily for the treatment of prostate cancer, on a business model that is now collapsing. So what started to happen in the United States is that some of these centers have closed, others will likely consolidate, and the risk is that the bubble will actually burst. Now, I hope that won't happen, because I think proton beam is a fantastically accurate form of treatment that's not only useful for children, but if we put our minds to it and did the research, is likely very useful in the common cancers of adulthood. But if the balloon completely bursts, a very promising and wonderful treatment is going to go away. Now, Britain has been very slow to take up on proton beam therapy. Quite rightly, it figured the costs are so high, we're not going to rush into this. And they didn't. So right now, there are 0 British centres. But next year, 2 will open. Well, not next year, but actually next year and in 3 years' time. Britain will have 2 major centres, one at the Christie Hospital in the north and one at UCLH in London. And why has it come about this way? Because the government essentially set up a commission that thoughtfully considered this situation, worked out where we needed, well, we meaning the United Kingdom, needed proton beam, which specific indications. It worked out how many centres it needed and it could afford, and has built them. So the 2 centres in Britain will open with a strong academic research model. They will treat patients and they'll develop the evidence base that we need to determine whether more need to be created in the future. So Britain is on a late, slow rise, just as America is on a steep decline when it comes to proton therapy. And the other thing that's extraordinary is that the United States, having spent all these decades not developing the evidence base, not doing the clinical trials that were so necessary, is now turning to nations like Britain and Holland and asking Britain and Holland to develop the evidence for us. So I think these are actually quite exciting times for Britain and radiotherapy generally. Britain will though it's a Johnny-come-lately to proton therapy, is coming in at the right time to deliver the world what it needs, which is thoughtful evidence.